Hello, welcome to Shaka Extra Time. I am Paul Indiho. Joining me from his home is Shaka Sali himself, aka the Kabale Kid. Okay, hello Shaka.
Hello, Paul.
How are you?
I remain simple, easy, and as some of my fans have suggested, an awesome son of Africa.
I see you're taking COVID-19 very seriously and you have a mask on.
Man, you have no choice because you're talking with an enemy who does not even apply or require for you to grant them a visa in order to somehow show up in your neighborhood.
Very good, very good. Today, Shaka and I are going to be discussing COVID-19, the impact it's had so far, and what people on the African continent are doing about COVID-19. Shaka, so let's start by maybe talking about the updates. The numbers seem to be going up. Let me maybe start by getting a quicker response to that.
You know, Paul, to be very honest with you, I do not look at some of those statistics very seriously. Because when you think about it, you're talking about a continent that has more than 1 billion human beings. You're also talking about a continent, when it comes to healthcare infrastructure, it is very, very challenged. When you look at those numbers, to be honest with you, I think the immediate question that needs to come to your mind is, what do those numbers reflect? Do they reflect the accurate assessment of what is happening on the continent, or do they in fact reflect the measure of the healthcare infrastructure that would allow a lot of those countries to get into the business that would give us a sense as to how many people are infected so far? And here we are talking about testing.
How about in places where, for example, like in Algeria, there is massive testing there. In South Africa, there is massive testing in Egypt. And I guess you see a lot of numbers there. Could that be maybe partly a result of massive testing because of the cases that we see out there?
Well, first of all, those two countries that you have mentioned, these are countries that are rich. And especially South Africa, it has a very, very respectable healthcare infrastructure. As a matter of fact, a lot of very good doctors and nurses in other parts of the continent, they actually run to South Africa for greener pastures. You've been there. I mean, you know that South Africa, in a sense, is perhaps one of the few industrial countries on the African continent. And in fact, a lot of things that happen there could actually be equated with the developments in the countries that are equally developed in North America and in Europe. But when you go to these other places like Central Africa, for example, you go to the Democratic Republic of Congo, you go to Congo Republic, you go to Benin, where you go to Gabon, where you have been, and all that kind of stuff. I mean, we've been to some of these countries together. You know as well as I do, even people sometimes who suffer from a very simple flu do not get the basic treatment that they need. Now, when it comes to records, when it comes to recording people who have been infected in this coronavirus, you have seen how, for example, the United States of America has failed. And yet, the United States of America happens to be the richest country on this planet Earth. And when you talk about technology, you're talking about a country on the technological cutting edge. And yet, when it comes to the numbers, the statistics of the coronavirus pandemic, the United States is heavily challenged. So it's not a very simple thing, sincerely, that we should simply look at these numbers that are supplied to us in as far as Africa is concerned and take them as reflections of the reality of the situation on the continent. What we probably should be talking about is, how are the authorities and the stakeholders fighting this incredible enemy.
Just go back to the United States. You talked about the United States, how it's facing a bigger challenge. But there are some states that have really done incredibly well. Even federal government, to some extent, has done its part really to make sure that people get ventilators. People, there are enough beds in the hospital. The Army Corps of Engineers has also been building hospitals just to supplement the already to fill in the gaps.
There are a lot of good things that have been done, Paul. That one I agree, but we are not yet out of the woods. When you look, for example, at the epicenter, you're talking about the great state of New York. When you look at the state of New York and look at the number of people that actually have been found to be infected, right now, the state of New York has the largest number in the world after, guess who? The United States of America. So it's not that simple, my brother. I think that there is still a lot to be done. And as a matter of fact, the US is really beginning to get there because they are beginning to do lots of different types of testing. And also when you look at also the scientific research front, there are lots of companies, for example, and research universities and institutions and stuff like that, which are also getting into the business of trying to see if they can get a vaccine. Because without getting a vaccine, this virus could actually devastate not only the United States, but the globe. There are also, of course, companies and research universities and institutions which are also in the business of trying to see if they can actually come up with some effective therapies. Because up to now, I don't know of any effective therapy that people can actually count on. And then, of course, people are also going to have to look for a cure. But when you talk about a cure, you talk about a vaccine, for example, we are probably, at least according to scientific experts and public health officials, we are probably looking at 1 year and beyond. In fact, the recent information I have on that front is from Britain's premier Oxford Research University institution. They're saying that we should be probably thinking in terms of the earliest being September.
Interesting.
And I think what we should be really talking about right now, we should be talking about, for example, how governments, how stakeholders, how business people, how those, for example, who have the opportunity to feed the line, to whom much is given, more is expected, so that they can actually be there as their brothers, as their sisters, as their neighbors' keeper. This is the moment that we need to take advantage of the beautiful African culture, which is extended relationship, which basically allows us to be there in time of need for those who are needy. We are talking about people who are economically challenged, people who are financially challenged. We are talking about people who are mentally challenged, physically challenged, all sorts of people.
You talked about maybe looking out to be your brother's keeper, looking out for people who are physically challenged, financially challenged, and to help out. But at the same time, all these governments have imposed sort of a crackdown, and the social, because they are trying to do or to follow the social distancing guidelines. A lot of people are stuck in their homes; they can't go anywhere. So, how is that going to be applied?
You raise a very, very important point here, Paul. First of all, when it comes to social distancing, let nobody deceive you that it is something that you should be looking at as optional. This is something that must be done under any circumstances. But in order for you to benefit out of that process, you need to do it in a manner that is very creative, in a manner that is very highly imaginative, in a manner that is very highly innovative. You need, for example, when it comes to Africa, you need to discourage people to get away from this business of greeting one another with hands. You need to be able to inform your people that this is the kind of luxury that we can no longer afford under the circumstances. You should just talk like the way we talk back in Kabale, southwestern Uganda, the Garant Bachiga. We just meet you and say, Agandi, meaning, what's the news? Without touching you. And you say, you're terrific. Or you meet somebody in Nairobi or Dar es Salaam and you say, habari gani? You respond, nzuri, without necessarily touching one another, without high-fiving each other. Because this is very necessary, because the last time I checked, this great enemy that is called the coronavirus pandemic does not have respect for borders, does not have respect for boundaries, does not even require a visa, Paul.
That's correct.
If it wants to come in your neighborhood, it will come, and it could actually be there with you, and you don't even notice it. You don't even know that it's there. So the most important thing is to make sure that you reduce interaction, and therefore you must invoke social distancing. But having said that, government should actually step up. I was looking at a news magazine which lists those people who are very rich globally. And when it comes to Africa, it actually suggests that most people who are very rich, with the exception of the few, are people who also wield political power. It talks about, for example, presidents. It talks about prime ministers. It talks about cabinet ministers. It talks about ambassadors, judges, those types of people. And so, as I said at the outset, the line that to whom much is given, more is expected. These people should rise up to the occasion where they should be in a position to mobilize, organize resources for the people who are less fortunate than them.
Shaka, you bring up a very good point. For example, here in the United States, and I've seen it happen in some parts of Europe, to some African leaders' credit, they have also stepped up to the table. They have, for example, in Ghana, the president announced a while back that the government was going to take care of water bills and electric bills for every citizen in Ghana. Some countries, Uganda, Rwanda, and other countries have also stepped up. They're distributing, Kenya. They're distributing food and trying to make sure that people are taken care of. But the point I wanted to make is, for example, here in the United States, a lot of people, over 80 million people, are going to benefit from what they call the stimulus.
The economic stimulus.
Yes.
Yes.
What does it take for some African governments really to maybe to borrow a leaf from that and try to figure out how they can, at least for the time being, help out ordinary people?
Paul, I think that is a very important question that you raise. First of all, I think the African countries will probably tell you that they do not have the resources, but that I think what they should do, they can borrow, they can print money, they can use the money that they receive as taxes from their people to see that they provide the badly needed economic lifeline not just a stimulus, economic lifeline. Because I have been seeing reports, Paul, where some young people are saying that their governments have, for example, introduced policies of where they must not leave their houses, they must not leave their homes, and yet they have no food to eat, they have no water to drink, let alone when you talk about cleaning your hands with soap and all that kind of stuff. In fact, they were wondering whether they are now going to fight two different, very, very strong viruses. That in addition to the coronavirus pandemic, they might in fact end up also fighting another virus, which they call starvation.
You're
I
absolutely
think
right,
this can be
Shaka.
avoided.
You're absolutely right on that.
Yeah, I think this can be avoided by the government stepping in, providing adequate economic lifeline to their people until the situation is back to at least a semblance of normality. Also, the rich people in those different countries. I have seen, for example, that in Nigeria, the richest man in Africa, Alipo Dangote, he has contributed millions and millions of naira, the Nigerian local currency, to go towards helping people that are in need. Your friend Tony Erumeru.
Right. Took it even further. He took it to a continental level.
Exactly.
Yes.
So again, this is the issue that responds to the line that I mentioned earlier. To whom much is given, more is expected. This is really the time not to get into politics, for example. This is the time for individuals, whether they are politicians, presidents, and what have you, not to do things because they have to win some political points. This is a time when you get away, stay away from theater.
Right.
This is a time when you get away from being a clownish, like I saw a story from the Kenyan capital, Nairobi, where a governor, Mike Sonko, was, for example, talking about sending some packages to people who are needy, including some small bottles of Hennessy cognac brandy. I mean, come on, man. I mean, let's be serious. People need food.
Right.
People need water. I was in fact told that yes, in some cases, you may actually use alcohol for sanitization. But that this particular Hennessy brandy does not in fact have the type of alcoholic content that can even benefit you in that particular front. So I think that we should be very serious here. We should actually look out for things that can in fact make a difference in people's lives.
Let's go to some of our Facebook comments and questions. Let's start with Walter Ochenike. I wonder why this country called China is treating Africans this way, especially the fact that the Chinese wealth is based on resources gotten from Africa. Your response?
You know, of course, I couldn't agree with my brother more. I have been saying, that, for example, the Chinese have the distinction of being the second largest economy on this planet Earth, courtesy of Africa. When you think about China being the factory of the world, they have become a factory of the world because they must have oil from Nigeria, for example, where that particular individual seems to be coming from. They are getting oil from Angola, from Gabon, from a lot of different African countries. They are getting cobalt from the Democratic Republic of the Congo, from Zambia, from other places. They are getting coltan, which is, of course, is used in smartphones, laptops, video games, X-rays, and you name it. They are getting these strategic minerals from Africa, and they don't seem to find any type of corona in these particular strategic minerals. But when it comes to people, human beings who look like them with the exception of having a different culture, a different color of the skin,
Right.
somehow they get into these stereotypes, looking for some kind of scapegoat that probably might make some of them feel a little bit good about themselves. I think that it is a question now of policy. I think that the leadership in Africa should step up, should contact their counterparts in Beijing, their ambassadors, for example, who represent African countries and reside in Beijing, the capital, should be able to deal with this type of situation.
Yeah.
Where is the African leadership when it is needed?
Let's go to another commenter from Nakova Lilian in Saudi Arabia. What do other people that are curing from COVID-19 doing that others are not doing who are dying?
Well, first of all, I think we talked a little bit about the issue of testing. You are not going to answer any question or going to come up with a solution unless you are aware and you know what the magnitude of the problem is.
Right.
So I think that first and foremost, we need to get the capacity to be in a position where we have to do three things: testing, testing, and testing. Once we are able to do that, then we can move on to the point where we can introduce the kind of measures that will allow us to take care of our people until science comes up with the magical bullet, the vaccine, comes up with the effective therapies that we are talking about, and hopefully at the end of the day, comes up with a cure. We need to be able to inform our people with accurate information. We need to make sure that the information that we are giving to our people is true. It is not disinformation. For example,
there's a lot of that happening on our social media, disinformation. How can Africans maybe or governments deal with that?
I think that, you see, it is good to get information from social media, but social media has the effect of being able to either play a good role or it can actually be misused and play a very bad role. And so the gatekeepers in the different countries in Africa need to make sure that the information that is addressed to the people and the kind of information that people must take seriously is the type of information that is true. And it can only be true if it goes through at least the sort of traditional means of communication, where you have individuals who have done the necessary cross-checking, cross-checking until they come up with the facts. Because the only thing that this virus, the coronavirus pandemic, knows is the facts. You have to make sure that your information is scientifically and factually sound, not propaganda. This is not Hollywood. This is not theater. This is a situation where the information that you share with your people can make a difference between life and death.
Very good. Let's squeeze in two quicker comments. We're almost running out of time. Let's go to Ajuna Haji. I think the lockdown extension for most African countries is a welcome idea.
Yes,
Perhaps it has saved many lives. Do you
very
agree?
good. I think it does. I mean, there's no question that the facts are there. When you look at where the virus even came from, you look at the steps taken by the Chinese authorities. Even a place that was the epicenter, Wuhan city, and what have you, they were able to lock down tens and tens of millions of people. And life is apparently beginning to be restored slowly but gradually. If you go to South Korea, where apparently they took steps that were very effective, it was locked down. If you look at Singapore, it was locked down. If you look at Taiwan, it was locked down. If you look at Hong Kong, it was locked down. And so, let's face it, if it can work in those different countries that I have mentioned, it means that it can also equally work in Africa. This is where we need to be in a position where we borrow from other human experiences.
Very quickly, Okisi Charles Vincent says, is there any hope that scientists are working around the globe to come up with a vaccine? Is there something like this that will happen anytime soon?
Well, I don't know about anytime soon, but eventually they will definitely come up with an effective vaccine, just like they have actually come through before. We had, for example, the scourge of HIV/AIDS. HIV/AIDS is no longer as dangerous as it used to be because those same scientists we are talking about were able to come up with effective drugs. We are able to come up with some vaccines. Malaria, for example, tuberculosis. Back in 1918 and 1919, you had the Spanish flu. The Spanish flu killed apparently anywhere between 45 to 50 million human beings. But it eventually was able to be contained because of the scientific miracles. I have no doubt whatsoever that at some point in the near future, we are going to come up with a major breakthrough.
Yeah.
It is going to be an effective vaccine. It is going to be the effective therapies. It is going to be eventually a cure that will help us to go back to where we used to be. And I hope that at the end of the day, Paul, the human family learns from this tragedy in the sense that they can actually see what is happening right now as an opportunity that provides us with a great window of opportunity to look at one another, to regard one another as a huge human family.
Shaka, we have to
Based
leave
on
it.
the truth and love.
Shaka, that's a perfect segue to end this segment. Thank you so much for being a great guest. I look forward to hosting you on another edition of Shaka Extra Time.
You're most welcome, Paul, and it is always a pleasure to be your guest on Shaka Extra Time.
Thank you, and we look forward to interacting with you on another edition of Shaka Extra Time next week.